and good afternoon. Thank you for joining us for our COVID-19 press conference here at the Office of the Governor of Guam. I'd like to acknowledge the presence of our Honorable Magahaga, Governor Lou Leon Guerrero. And to her left, we have Dr. Felix Cabrera, representing the Physicians Advisory Group as well as the State Surgeon Cell. Governor, for your remarks.
Thank you, Crystal. Half a day. To date, there have been a total of 307 confirmed cases of COVID-19 with 5 deaths. 202 of these 307 are released from isolation, and we have 100 active cases. Of those cases, 261 of the 307 cases, 261 are classified as civilian, and 46 are military service members. I know you may be concerned with the number of positive cases that have been recently confirmed. However, this increase was expected because we increased our testing capacity. We have tested over 16,000 specimens, which translates to about a 9.2% of our population. Based on this data, we have a 1.6% case fatality rate and overall positivity rate of 1.9%. And we are averaging over 200 tests a day. I have said before that our policies are based on the following 4 criteria. 1, a stable number of new COVID-19 positives. 2, adequate hospital capability to treat new cases as they arise. 3, capacity to test all people with COVID-19 symptoms. And 4th, ability to contact trace efficiently and effectively. If you remember, flattening the curve is not about just decreasing cases alone, but also about decreasing the number of cases requiring acute care. Despite this increase in positive cases, our hospitalization rate has remained stable, with cases needing hospitalization ranging from 0 to 3. I am also confident in our contact tracing abilities. Many of our new cases were identified because of the work of an efficient public health tracing team. Their efforts have received national attention as well. Based on NPR's analysis on contact tracing, Guam was identified as one of several states and territories that have enough contact tracers, estimated to be needed on an to investigate our current burden of recent cases. And we are currently in the process of increasing our capacity. As we begin to lift restrictions, we made sure to increase our testing capacity. We have held 30 community outreaches for testing. In the Manilo outreach alone, over 800 people were tested. If you're feeling sick or experiencing symptoms related to COVID-19, I encourage everyone to see their doctor or call 311 option 1 to speak to one of our public health nurses. While we continue to test and contact trace, we all need to do our part. You have heard time and time again that we cannot become complacent, and this is true now more than ever. While most businesses have opened, we still need to practice social distancing of at least 6 feet. Wear your face mask even when you're visiting family or friends. Practice good hygiene. This is how we can continue to beat COVID-19. Okay, now I give it over to Dr. Cabrera, who will go over some numbers with us.
Thank you very much, Governor. I'm going to share my screen here. Okay. Okay. All right, we're back. Sorry about the technical difficulties. I guess my slides were so intriguing, we broke the internet, so we had to reboot. So I'll go ahead and share my slides again. Okay. So these slides are basically, we're going to be going over, it's another status update of Guam's COVID-19 cases with assessment of our response so far with our efforts, and an update on new high-risk area lists for quarantine purposes. So first of all, just to recap that we have now a total of 307 cases. That includes the cases, 4 cases that were announced from earlier today. And over the past 7 days now, we've had a total of 36 new additions. In the past 7 days as well, we've had 4 new patients being admitted to Guam Memorial Hospital, although the peak census has been no higher than 2, but total new is 4. And the days since the last COVID-19 related death is 88. I think it was important to put that there for perspective of how far we've come along. And when we talk about COVID-19 cases, new case counts, and all these other data, we always have to keep into perspective what it is we're trying to ultimately prevent, which is untimely death and poor morbidity and mortality overall. So as of more recent, if you look at our daily new cases, as the governor had mentioned earlier, she went through the criteria for our reopening, excuse me. And so our daily new cases has averaged about 5.1 over the past 7 days. And we had initially established that a threshold for concern is 5. So technically we're above that. So yes, we are a big concern, as I'm sure many are with the elevated new case counts per day. However, our test positivity rate is only 1.59% over the past 7 days. And our threshold for that had been 3%. And so this is well below that. We did rise above that over the past several weeks, but then overall we've done better. And our daily hospitalized census, also 7-day average, is at 1.9. Now the threshold is not straightforward, it's variable, it depends on the hospital capacity and ability to take care of these patients. But just to remind everyone that back in early April, the highest hospitalization census we had was 25. So it's a far difference from that. And so put it in graph form, and I promise this is the only graph that I'll put up for today. So basically, if you look at the 36 cases over the past 7 days, it's put our daily average above the threshold of concern. However, test positivity rates and hospitalizations remain low, which offers reassurance that our strategy and capabilities are proving strong. So this graph here looks at the number of new cases, test positivity rate, and hospitalizations over the past month. So from June 8 up until July 8. And the purple being hospitalizations, as you can see, has been very low, and then has had the slight increase over the past few weeks, but then still 2 is where it's been the peak amount of patients being admitted at GMH with COVID-19. And the test positivity rate had significantly went up, but in response, we actually increased our number of tests overall to identify more potential new cases. And as a result, our test positivity rate has gone down, because even with the increase in new cases, as you can see here in the red line, our test positivity rate remains well below 3% and mostly below 2%, which is really reassuring. And just to give additional perspective, on June 10, that week, the number of tests that we had done was 725 tests that week, with an average of about 120 per day. Over the past 7 days, from July 1st to July 7th, we've done 2,433 tests. So nearly tripling the amount of tests that we've done prior to. And then that's averaging at 348 tests per day. And so what that basically means is that when we started seeing this spike up in case counts, we increased our testing capacity to cast a wider net and to catch more new cases. And as a result, we have a lower test positivity rate. So that's the key part there, is to make sure that these lines don't just take off and become and grow exponentially, but then we see this where it drops down, and if it rises, it's a steady and slow rise. So now moving on to the updates for the quarantine for travelers coming into Guam from high-risk areas. So there's been no changes to the current algorithm as it is right now, as it's displayed here. This was introduced back on June 27 and went into effect on July 1st. So no changes to this as it is right now, but on the next slide, I'll be going over an updated high-risk area list. So this is the new list here, and it is going to be effective on July 13, 2020, and so after midnight. And as you can see here, there's a list of the high-risk states, and in the asterisk are the new additions. So basically, there's 7 new states being added to the list. They're listed here alphabetically. In terms of the high-risk Asian Pacific countries, there's no changes to that, as well as for the high-risk continents and regions. We did add this additional category for other high-risk countries that didn't fit the other descriptions, namely Bulgaria, Croatia, Mexico, Sweden, and Ukraine. And so if you're coming from these high-risk areas, we're giving you about 5 days advance notice, so that when you look at this algorithm here, that you would prefer to have a PCR test that's done less than 72 hours prior to your arrival to Guam, and if it's negative, then you're allowed to start your quarantine at home, or self quarantine as it's otherwise stated in your hotel or what have you. If you don't have that, then you will be going still to a government facility quarantine, and then the rest of the algorithm has not changed from there. So again, going back to the list here, I'll just name the states: Alabama, Arizona, Arkansas, California, Florida, Georgia, Idaho, Iowa, Kansas, Louisiana, Mississippi, Missouri, Nevada, North Carolina, Ohio, Oklahoma, Oregon, South Carolina, Tennessee, Texas, Utah, Wyoming, and Wisconsin. And that's the end. Thank you. Governor?
Now I'll open the floor to questions for members of our media. First up, we have from the Pacific Island Times, Johanna. I actually no longer see Johanna in the Zoom room. Moving on to the Marianas Business Journal, Maureen.
Buenas, Dr. Cabrera, Governor, not necessarily in that order. I hope you can both hear me okay.
Yes.
All right, thank you. So maybe both of you would could weigh in on this particular question. So thank you for the numbers, Dr. Cabrera. When I go about the island, I get the impression that the demographics of our residents who are also going about the island is very mixed. And then when I look at the profiles that we get from Crystal, the highest numbers of positives are people who are between 20 and 69. So if that's anything to go by, there's a broad range of ages of our citizens who have decided to venture out and about. Obviously, I think most people on our island are wearing masks. So whether there's a degree of fear or not, people seem to be out and about. There are traffic jams. There are people in the supermarkets and stores. So what do both of you think that signifies? Does it signify confidence in our community? Does it signify confidence in our testing? I mean, clearly, it's not like in March when everybody stayed home. Could you both please comment from your respective perspectives?
Right. So, if you recall, Maureen, that we started lifting restrictions when we were confident that we had contained the virus. And our confidence was based on the positivity tests, and our confidence was based on our ability to test more and our ability to do effective contact tracing, and of course, our hospital healthcare delivery system capacity. And as we felt that we were confident that these capabilities are able to monitor and trace and address coronavirus, that's when we started lifting restrictions. And when we did decide to lift restrictions, we were aware that we would see more positive cases because, again, we would be testing more. But what we're seeing is what we really want it to be: increase mobility and contain coronavirus. That just says to our community that despite the fact that people are going out and doing more activities, and we still are able to maintain a below 3% positivity rate. And what that tells me is that we are abiding I think, very well to the preventive measures that we are out there adamantly advocating for. You're right. I have gone out and I have seen even people just walking on the streets wearing masks, and that's good because that is what we want people to do in order for us to get back to some kind of normalcy in our lives. Additionally, I also see adherence to social distancing. And I think as we continue to be very compliant in these measures, you will see that we will be able to contain the virus. So Dr. Cabrera will tell you that one of the things we look at is the mobility of people. And we are seeing increased mobility. And as we start opening more events and more activities like the church, where people go, and also supermarkets, grocery stores, Home Depot, although those were already open even during the pandemic crisis, we also are seeing more dine-in restaurants, and that's what we want to see. We want people to start doing this so we can have an idea of how well we have contained. If you also will notice that our increase in testing has been very surmountable, I think. We're now 16,000 that we've tested in our community, where before we weren't able to even do 1,000 or 2,000. But because we have the testing capacity, that is, we want to do that because we want to see again how well we're doing in the community. Additionally, as you know, we also have contact tracing, and most of these cases that you are seeing in positives is through household contacts. So that's good. That means that it's within clusters. Although we are concerned that there is community spread, but it is also very encouraging when we do our contact tracing that a lot of these are through household contact, which means we can contain better, address better, and isolate better. So all the things that we're doing right now, I think we're doing it on the right track. Especially the fact that we are monitoring very closely daily on a regular basis. And of course, if we start seeing those markers, those criteria that we just mentioned, if we start seeing more of, then we will have to make a different direction, a different strategy. But for now, I really believe we're doing really good as a community. Dr. Guerrero, you want to add?
Yeah, Governor, you hit all the main points there. So just to answer the original question, basically is that yes, we're seeing a higher increase in terms of the age group and that are younger that are being positive, and I think that's to expected. They're the ones that are going to be more likely mobile, and they're the ones that are more likely going to take risk. But I think the key part here is that there was a reason again why on the slides it said it's been 88 days since we've had the last known COVID-19 related death. And I think that's a very, very important point to make because despite seeing fluctuations in our case numbers, is that Guam as a whole is doing a great job of protecting the vulnerable. And I think that's really key, and I think something that we should all be very proud of. So even though you're not seeing and you're seeing that in the numbers because you're not seeing also a higher number of elders being infected and turning up positive and ending up in the hospital. So those points have to be made. Now, by catching these younger ones early, that further ensures that we protect the vulnerable even more. And that's where the contact tracing really plays a crucial role. And I think public health team has been doing an amazing job. They are not perfect, and they may not call you when you want to be called exactly and return your calls exactly when you want. And in ideal situation, they'd be able to do that. But they're prioritizing the areas and the persons who need to be prioritized. And that is what's keeping Guam safe.
Maureen,
All
your
right,
follow-up
thank
question?
you. Yes, so I'm getting a pretty positive impression here. So how long do we wait before we take further steps to do something for our business community and particularly our tourism market?
So right now, we are doing a lot for the business community. We've opened all retail businesses. We've opened basically restaurants, hotels. So I don't think we're ever closed. There are some activities that we still are keeping them restricted. We are looking, Maureen, for the next week and a half, and 2 weeks to see how things are going to be going. And certainly we are considering going into the next phase of our PCOR, but that probably won't be till we see more data and we see within the next week and a half to 2 weeks.
Okay, thank you.
All right.
Pacific News Center, Kevin Kerrigan. Kevin's not responding at the moment. I'll come back to him. Nestor from KUAM.
Yes, thanks, Chris. Good afternoon, Governor. Good afternoon, Dr. Cabrera. I just wanted to follow up a little bit more on Maureen's question about reopening tourism, because as you guys were explaining the numbers, it sounded a lot like you were making the case for being able to reopen soon. Is there a target date? I know that Governor Gutierrez had mentioned July 15th as a date that he would want you to reopen tourism. And I know that Hawaii is going to open on August 1st. So do you have a target date for reopening of tourism if all goes well?
No, I don't really have a target date yet. You know, we're still discussing this with our business community and also with the physicians advisory group. And again, when we do look at the opening, we also have to think about how do we treat inbound passengers and inbound travelers, and how does that relate to what kinds of protocols and what kinds of procedures that we would be doing in order to still protect our community, Nestor, and also to be able to balance out the ability of our economy to move forward and to be, again, be robust like it was before. And so that's a balancing situation that I need to look at. But we are in close communication with the tourist industry. They're doing some surveys in their market countries, and we are in constant communication and discussions about it. I want to make sure that when the decision is made, that again, we balance both the protection of our community and ability for our economy to move on.
Yeah, thank you, Governor. Speaking of economy, I think that's one of the reasons why, and we spoke with some Hawaii officials yesterday, that's one of the reasons why they were pressed to try and reopen their tourism industry
Right.
by August 1st, because like us, that they depend so heavily on tourism. So there is that sense of urgency. Are you feeling that same sense of urgency to reopen the tourism industry because it's so important, so vital to our economy?
Sure, of course. Tourism is one of the major drivers of our economy, and thousands of jobs are dependent on tourist activities. Of course, our ability to also provide public services is dependent on taxes that as a result of the increase in the economy. So yes, there is urgency in terms of how I look at it as promoting and developing our economic health. And to make sure that we put as much attention into economic health as we do for our public safety and public health. So there is an urgency. I don't know what the protocols are going to be when Hawaii opens on August 1st. I don't know if they're going to still require testing before travelers get into their community. I hear they may still continue that. That's one of the discussions that we are having with our industry, with our with our GVB. What are the requirements that we are going to put on travelers that come in, again, to assure that that our community is safe. And one of the biggest things we look at too, Nestor, is where are these people coming from? And if they're coming from like a very low risk area, then, the requirements may not be as stringent as those coming from a higher risk. And so one of the things we do look at on a daily basis is the where these countries stand in a scoring of risk, and where do the states of the United States stand in the scoring of our risk? Because as you know, many of our people that are returning are also returning from high risk states. And that's something that we are looking at. And when they return from a high risk, they follow certain restrictive protocols to assure again that our community is safe. And if they come from a low area, we may look at it not being so restrictive because they are coming from an area where they have contained their virus, or some may not even have any more concerns. Like Japan has raised their public health emergency. Taiwan basically is a 0 in the scoring of the risk. They have surely very much demonstrated a good containment of their virus. And so does South Korea. These are countries that are very low risk. And there are states also who are very low risk. New York is one of them. I forget what the other ones, but there are a couple. I think New Hampshire, New Jersey. And so those people that are coming from those areas would then follow a different protocol based on the risk of their area.
Thank you, Nestor. PNC, Kevin Kerrigan.
Yes, good afternoon, everyone. I'd like to ask the governor whether or not the contact tracing of those 35 airmen who visited the 30 businesses has been completed, and whether she is aware of any additional positive cases have been found at any of those businesses, and whether or not any disciplinary action has been taken against the airmen.
So my information about the businesses, I know that most of those, I'm not sure of all of them, Kevin, but they are in the process of having their employees tested. there were no negatives in those contact tracing. Oh, sorry, no positives. Sorry, no positives. I didn't want to scare you, Kevin. So there were no positives in those contact tracings. Also, the head of the contact tracing did inform me that the positives that we do have are not at all connected or related to the 35 airmen. I don't know if they're already released. I think some of them may have already flown off to other places. I'm not too sure about that, but I do know our contact tracing does not connect our positives with those airmen.
So it sounds like it's rather the good news. And as a follow-up for Dr. Cabrera, what does it say to you, Dr. Cabrera, that 35 infected airmen were loose for a couple of weeks in Tucson, and yet there have been no positive cases stemming from that incident? What does that mean?
Well, I think it means as much as we can infer just from how deep of the contact tracings went, and that they were primarily looking at primary contacts and secondary contacts. We can't necessarily comment on tertiary contacts, in other meanings at third 3-degree separation, and there's no way we'll ever know what effect that had overall. But I would just like to go back and just remind that the same time we were seeing the positive cases in the airmen were about 13 days after the June 8 change in our quarantine policies. And so even though it became more strict on some hotspot areas, that it became less restrictive in persons coming from the mainland United States. And so there may, that temporal relationship may have played a significant role in that overall. But it did allow that same policy did allow the airmen to quarantine in a hotel, as opposed to that's not a Gulf Guam facility, and so that may have played a role overall. But that was about an equal risk pool for them, as well as the other rest of the civilians that traveled during that time period under those quarantine standards.
Thank you.
Thank you, Kevin.
Thank you.
I just want to add something too. As soon as they found out about these positive cases, and I know that they were all pulled into the base for closer security and monitoring of them being in quarantine and in isolation. So I think that worked. Also, I do know that at my request with Admiral Manoni, that during that period of time, we had open bars, and I requested that the military not be at the bars, just because of the hot spot of their 35 airmen in the military, and that happened. So there was like about maybe 10, 14 days of that, and I know Admiral Manoni lifted it just this last weekend, I believe, because of things were much better in terms of the containment of the virus.
Thank you, Kevin. Guam Daily Post, Heidi.
Good afternoon, Governor. This is about revenue. What's the initial revenue estimate for June? Hawaii and the CNMI are implementing budget cuts. What is GovGuam doing to prepare for a possible prolonged economic downturn?
So I just want you to be assured that our government and our administration is very frugal. Our government and our administration are using our financial resource as best we can to continue providing the public service that our people need, continue to providing public safety, education, and healthcare. So we are very fiscally disciplined and manage our cash flow very well. Again, what has helped again is the federal monies that have come in. You'll see that the pandemic unemployment benefits is starting to be in the hands of our people. As a result of that, we continue to get withholding taxes from that. So that's a good revenue source for us. Additionally, with the CARES Act being able to now fund payroll related to COVID, there's that general there's those revenues that we can use to put back into operations and operating our our government. If you see our government budget, our budget actually for 2020 is either comparable to 2019 or less than 2019. And so we are very frugal, Heidi. We are very mindful about our expenses, and we will continue to be that given, again, the limited revenues that we will be getting.
Thank you, Governor. Speaking of, you mentioned about the PUA. Do you know if there's an additional batch processed this week?
I know that they are continuously clearing employee applications. I know that every week they will be giving out on a regular basis these batches for the PUA. So yes, there is. I don't know exactly what it is, but I do know that we continue to provide the PUA monies out. I think we have over about, maybe $100 and some million that we already put in with PUA.
Heidi, we just received the latest update from Dave Della Sola from the Department of Labor. The
Yes.
fourth batch of PUA will be hitting the banks on Monday, July 13th. This batch is $20.8 million, giving a total amount given out to date at $140 million. So again, on Monday, July 13th, we can expect the fourth batch of PUA payments.
Crystal, do you have the data as up to what date will be covered by that? What
We'll get
filing
you
date?
Dave Della Sola to respond
Thank
shortly
you.
after the press conference. Thank you, Heidi. Moving on, Jasmine from PDN.
Hafide, just a question about the current quarantine protocols. That test that travelers can take on day 7 or day 10, is that a test provided and given by GovGuam, or do people have the option of going to or taking the test themselves?
Sure, I'll take that question. So first of all, it is run by public health as the default, but ultimately it's based on availability. It's subject to availability, and the priority goes to those that can shorten the government quarantine stay. We are open to, if there's arrangements that can be made with one of the private labs or another means, then we'd be of course open to that. But those will likely come out of pocket and not necessarily even covered by insurance. So we're open to all these different possibilities. If they're a member of the Department of Defense, and if the Department of Defense wants to run the tests, then we of course are open to that as well.
Thanks very much. The public health emergency is up until July 30th, but in August, Governor, do you think that schools will be able to open? Is that viable?
So schools is a major priority also in our consideration for reopening. And so we are under discussions with the Department of Education. And so we want to be able to reopen it, but we are looking and working with DOE to look at what their guidelines are. Public health is going to be issuing minimum guidelines for reopening of the schools. And so, yes, we want to be able to do that, but we want to make sure that when we do that, that there are guidelines along with it, Jasmine, that would continue protecting our people and our students, their teachers, employees, and of course the community.
Thank you, Jasmine. Moving on, Tomas Minglonia, I-94.
Hi, good afternoon, everyone. Governor, I just had my first question for you with regards to the homeless shelters. We know that the Mayor's Council was recently folded in with the Interagency Council for coordinating homeless programs. Is there a status update with the shelter and the holistic services that you mentioned?
Yes, so we are looking at awarding a facility, I think sometime this week or early next week. We're almost there, and we are looking at several options. But again, that's a top priority in our mind and also in our projects moving forward. As you know, we did do an executive order that created the Office of Homelessness and Poverty Assistance under the Mayor's Council. And that will, as soon as it's staffed and as soon as we find the space for it and so forth, we are going to be opening that. They are going to be the ones that would be the overseer of our homeless program. So I'm very encouraged by the progress that we have made so far in identifying facilities and also in identifying an entity that would then run these facilities and provide the overall wraparound services for our homeless.
And for my follow-up question, both for the governor and Dr. Cabrera, I just want to shift to some national news or global news. President Trump announced that he will be withdrawing the U.S. from the World Health Organization. This morning, KUAM spoke with the president of the Pacific Islands Health Officers Association, Esther Muña, who says that this has implications for Guam, the Sinai, and Micronesia. What are your comments if the U.S. is in fact going to rescind its membership in WHO? And what impact does this have for Guam amid COVID-19?
So I think the impact it would have on Guam is that we would then be removed from any kind of guidance, advice, resources from the World Health Organization that has been very instrumental in our ability to address the COVID-19. And so, yes, it'll have some negative impact on our island here.
Thank you, Tomas. Moving on. Nick Delgado.
Dr. Cabrera, sorry.
Oh,
yeah.
Sure. So I think one thing specific is that if you want to just look at, again, testing, for example, and that the pathways that we've been able to get the capacity and the numbers to test have been through WHO pathways they've been allotted for Guam based on that. And so to be removed from that, removes us from that access overall. And that's just one tiny example of the implications overall. So hopefully that this doesn't have a real meaningful impact on not just our response, but the whole country's response. And that's why you actually have a voice in this in November, and hopefully that the people stateside can voice that.
I just want to say also that it's not just the COVID. We've been in membership with the World Health Organization, and we have been given a lot of good references about tuberculosis, tobacco smoking, anywhere from mental health, wellness to sexual assaults to human trafficking to drug addiction, all of this that is very much interrelated internationally. So it's not just COVID, it's also a greater, I think, a greater loss in terms of trying to be involved and to network with the other countries and other entities that we can all share information from.
Thank you, I-94. Nick Delgado.
Hi, Governor. Hi, Dr. Cabrera. So how many tests are available now, and what's the plan to scale the mass testing?
Scale what testing?
The mass testing that's being conducted, Governor.
Okay, so we have over 10,600 test kits. We are also going to be probably getting more machines from, I think, CDC. And so we're not holding back in mass testing. We are going to continue with our community outreach and continue in our mass testing, even more so if we go into PCOR 3, and even more so if we, again, open, say, our schools and so forth. We must continue with the mass testing, and we do have the capacity to do that.
Okay, and additionally, would you say that the containment may might have been greater had the mass testing been done early on, maybe back in late March or even in April?
You know, we could say that, of course, but the reality was the capacity wasn't there. The resources wasn't there, not just us here in our island, but throughout the whole United States. There was very limited resources and very limited test kits. And so what we did as a result of that, Nick, is we prioritize. And I think that was a good move by prioritizing those with symptoms, prioritizing those that, you know, maybe are vulnerable, more vulnerable, prioritizing those who are more in congregate, large situations. So what we did in light of the limited resources is exactly what is the right thing to do. And I think if we had more testing at that time, we would of course be mass testing, and we would be able to see again what our community spread would be.
Yeah, I'll just add to that, just saying that, again, just really going back to the part there that, yes, we did have a shortage in number of testing capacity overall, but the most effective part was our ability to stay home and follow the precautions and the orders from our governor. So that's the key part there. So if we had the same testing capacity as we do right now, I don't think it would have made much of a difference, because the main thing would have been to stay in, to shelter in place. Now, increasing testing comes with, and testing and tracing capabilities comes with increasing our risk taking as well, in order to improve our overall livelihoods. And so that's where the testing had to go and grow parallel with the risk that we were taking. And I think we're doing that in an extremely responsible way, way more so than the majority of the states in our union. So I think that's something that we can be proud of, and that we should continue to ensure that we don't let up on that.
Last
Thank
but
you.
not least, thank you, Nick. Johanna from Pacific Island Times.
Half a day, everyone. Hello.
Okay, Joanna.
Hi, I like your mask you're wearing today.
Oh, thank you.
She borrowed it from me.
Okay. Okay. Okay, so my first question is, why did GPD stop accepting people to get tested at the GGO testing at 9 o'clock when public health said that they would stop at 11?
I'm not aware of it, but they were probably working under the instructions of public health, and maybe based on what their you know, how many cars are already there, how many tests were available at the site. So I'm not familiar with that, but I do know that GPD would have been working under the instructions of public health.
Okay, so there was no way for them to get more tests or like bring more tests to GGO?
It may have been, no, there are tests. It may have been a ability of the manpower that was there. And because even I think in Manila, they were there till like 4, 5, 6 in the evening, even though they were only going to be there from 9 to 2, I think. They went beyond that. But seeing maybe at 9 o'clock, I don't know how many cars were already there. I'm figuring that they would probably won't be able to finish up in a very timely manner. Additionally, I just want people to know that even though the lines may have stopped, please be assured that you can still be tested. You can still go to our community health centers to be tested, and of course your own private physicians. And we will be continuing community testing and community outreach. Today we're doing Astumbo Derido, and so we're doing other places, so there's going to be other opportunities. But if you have symptoms or if you feel sick, call your doctor and make sure you stay home. Call your doctor and be tested if that is the course of action.
Okay, thank you.
Governor, for your closing remarks.
Yes, I'd just like to thank Dr. Cabrera for his very, I think, very accurate and very detailed tracking of data and information that is very important for us to make the sound decisions that we need to make to continue protecting our people and our community. And I just also wanted to thank everybody. I know that seeing these increased numbers can be alarming, and it is a concern. We're not, taking it too lightly or lightly at all. But I just also wanted to assure our people that our work in addressing the COVID, our strategies, our direction is the right things to do, the right actions that we have made. And again, based on science, data, and history and other experiences from other states and other countries. So I want you to know that our work and our administration is very much committed and very much passionate in making sure that we continue saving lives and we continue protecting our people. So please do your part in making our community safe by wearing your face mask, washing your hands, cleaning, sanitizing, and social distancing. Thank you, and Sidus Masi.
Thank you everyone for joining us.